Hey guys, welcome back to the channel. This is Sai Dental Vlogs and I'm back with another video. So today's topic will be about what important questions do government jobs ask you? The teachers, the professors, any kind of government job. So how you have to prepare and what are the topmost questions, what are the favorite questions which are being asked in a government job. So there are two different aspects what I am going to tell you, because in the upcoming COVID situation, a lot of government jobs have come up, not in the dentistry field, but as COVID surgeons, COVID warriors, as well as few other options are also available. Like today only, there is a job opening in AIIMS for UR category, for SC category, for OBC category. So positive things are showing up, right? As any ki there are no jobs at all, but still government is trying to help. There are few jobs which are being coming up recently. I have heard like a lot of jobs have come up in previous year in Odisha in OPSC, and a lot of jobs have come in Haryana government. So similarly, it's a ray of positive hope which is among the dentists. So we should be ready to prepare ourselves कि ऐसा नहीं हो कि suddenly exam आ जाए और हम कुछ prepared now, right? So this is the right time to prepare for a government job, and it's not very difficult to crack. I also got a government job, but that story is different, and I have made a video why I left my government job. If you want to see that video, you just can scroll through my playlist, and I'll just tell you in short that I had already opened my two clinics, and I was already doing a job, so that's why I quit that job and I didn't like join itself. So आप लोग बिल्कुल वैसा मत करिए, because I was already having two clinics and I was settled, so I didn't go for it. But for people, newbies, for new dentists who have passed out, you can easily crack it, right? There is no big deal. So what is the basic question they ask you? The basic question they ask you in a government job, any kind, like railways ho gaya, army ho gaya, then any kind of interview like OPSC, then ECHS, anything, they ask you about the basic emergency. How will you treat the emergency? Suppose a patient gets syncope, what you will do? So they'll ask you what? They'll ask you the causes of syncope. Then they'll ask you what you will do. Basic things. How to deal with pregnant patients. What medications which are safe to give in pregnant patients. These questions, if you prepare, like you have to sit and think. If you are an examiner, what are the type of questions they would have asked you? They won't ask you, tell me the dose of methylprednisolone, or tell me the dose of Visolone, or tell me the dose of all these things. They will ask you the dose of simple drugs what you daily write, like any kind of painkillers or antibiotics. So that we already have to read and then we have to answer. So where you will get these questions? So if you have Dental Pulse, if you go through the synopsis and read basic sciences very nicely for all the interviews, they won't ask you what is the nerve which is passing here and going there and supplying the terminal branches. They won't ask you what are the branches of external carotid artery. They won't ask you. But they will ask you about trigeminal neuralgia. They will ask you what are the causes of pain. They will ask you simple things which patients really suffer, like dental pain, cellulitis, abscess. What are the causes of abscess? What are the organisms which causes abscess? Why there is pus formation? Staphylococcus aureus, Streptococcus pyogenes. Simple. Which is the most important organism which is causing dental caries? Streptococcus mutans group of bacteria. So these basic things you have to know. Like suppose a swelling patient came to you, and how you manage the patient. That is the thing. Like you have to do it in a general hospital or in a private government college, whatever it is, or in a small CHC like community health center. You have to, suppose a villager come with huge swelling, how will you manage that case? They will ask you these simple questions, basic questions which you can easily answer, and it's not a very big deal. And they will ask you only, minded guys, they will ask you only 3-4 questions and they'll be able to know your level, right? If you are not able to answer one easy question like how will you manage a case of abscess, they will ask you another easy question. After 2-3 questions they will tell, okay, you can go, means you didn't get it. But if they are having some interest, they will ask you, keep on asking from 5 to 10 questions, and you will see how much is your caliber, how much marks you have got. For final year students, it's very important to score nicely in final year, guys. Joe, listen to me. Now they are considering in some government job final year marks, which is very, very important. So this is the way you have to study. So basically, if we tell anatomy, just read the applied anatomy like trigeminal neuralgia, It's the applied anatomy of trigeminal nerve. Facial nerve paralysis, how will you treat? What are the symptoms of Bell's palsy? Very simple questions. If you're reading pharmacology, read about the pharmacological drugs which we use daily, like paracetamol and drugs which causes decrease in the size of the swelling, antibiotics, analgesics, what we usually dentists use. Medicine and pathology, they are going to ask you about normal diseases of the oral cavity like herpes, leukoplakia, oral cancer. Simple things, the basic things, what a layman thinks, that only they will ask you. They are not going to go deeply into what is CEOT, what is pin-bog tumor. So you try to understand what I am trying to tell. बिल्कुल simple questions they ask. So कहाँ पे मिलेंगे ये questions? ये questions आपको Dental Pulse में मिलेंगे. You can read that and you can just have an idea. Just list down the number of questions and prepare those well, and surely you're gonna click. Give your level best. If there is one seat and we always think, अरे यार वो एक ही seat है मुझे तो नहीं मिलेगा. That's a wrong thinking. You have to think that one seat I will only get. Then only you will get. You should have a burning desire in your heart to get a government job. Right? So it's not that a big deal or a very tough thing to get. Just you have to be a little bit knowledgeable, you have to be a little bit lucky, and you have to be aware कि कब निकल रहा है job. That is very important because many people miss the dates of the exams, miss the date of the interview, right? And it's never that you won't get. You always have a chance of getting. It's same for every interview, whether it is railways, ECHS. So you have to know the basics. Otherwise, it's very difficult. Particularly in the army, they ask you a lot about emergency and emergency drugs, trauma, triage. How will you select a patient? Which patient to treat first and which to not? So these kind of basic questions on root canal also they ask sometimes. Local anesthesia is very important. They also ask about different patterns, different types of local anesthesia, and how to manage different type of patients like cardiovascular patients or patients with different kind of ailments like kidney disorders or hypertensive patients or diabetic patients. They'll give you a situation. The patient has diabetes, hypertension. What is your treatment protocol? So these things you have to understand and tell the answers. So if you have not followed me on Instagram, please do follow me on Instagram in Sai_dental. There I reply to the queries. I reply slow, but I reply. And if you follow in YouTube, I make regular videos and I make regular live sessions also in Instagram. So take care. Love you all. Take care.